Great. Thank you very much for the kind introduction, Hui. It's a pleasure to be here. And I thank the administrative team for making it such a smooth trip out to Hong Kong. So I'm going to give an account of how income inequality is associated with population health and well-being. So we know that income inequality has been blamed for a variety of social ills in social sciences outside of public health. We know income inequality has been linked to slower long-term economic growth, stagnant intergenerational mobility, political polarization, corruption, violent crime, et cetera, et cetera. I've given the references there, but I'm going to talk mainly about reduced life expectancy and well-being. And because I have only a short amount of time, I'm going to present a couple of the theories by which we think income distribution affects well-being. The first is just a purely mechanical effect of income distribution that I call the effect of absolute income. Second one is through relative income deprivation, and the third one is through the political economy. Each of these may be correct. Only some of them might be correct, but we'll see how far we get in my ability to convince you that income inequality matters. So we begin with the mechanical effect of income inequality. And this requires a bit of a thought experiment to illustrate. And so I want to imagine an island somewhere in the middle of the ocean, which has only 2 inhabitants living on it. And let's call them Tom and Hank, 2 fictitious characters. Now, Tom, the thought experiment is this one. Suppose Tom earns twice as much income compared to Hank. And the question is, how long can we expect them to live? And we have some clues from population health, because epidemiologic data predicts that Tom will enjoy a longer life than Hank, because there's a positive correlation between more income and more life expectancy. So if Tom earns twice as much as Hank, all other things equal, he should enjoy a longer life. Now, the thought experiment is, what would happen if we were to tax Tom a little bit of his income and transfer some of that over to Hank? That's the thought experiment. And in thinking about this experiment, I only require 2 assumptions. You only need to agree with me about 2 things. One is that the association between income and health is at least partly causal. I know I've met some economists who deny that income is causally associated with health, but I've tried to make the argument in this New York Academy of Sciences article that at least some part of income is causally related to health. I mean, not all of it. Some of it, because of confounding and reverse causation, but you have to agree with me that some part of it is. And secondly, you must agree with me that the shape of the income health curve is concave. Concave meaning that it's kind of bent like this. The more income you make, the longer you live, but there are diminishing marginal returns to income. And this concavity is very important, because you may ask, why isn't the relation between income and health linear? The more you make, the longer you live. And there are a couple of reasons why it's not linear. One is because there's a limit to the human lifespan. So at some point, you can earn billions and billions, but it would make not any difference to your ultimate lifespan. So it must be flat at some point. And secondly, there are diminishing marginal returns. It makes more of a difference to your life expectancy if you are poor to begin with than if you are already wealthy. So with those 2 assumptions in mind, let's do the experiment. So here we have Tom on the right-hand side with initial income X4, and Hank on the left-hand side with initial income X1. The average life expectancy on this imaginary island is the average of Hank and Tom. And remember, my requirement is that we're assuming that this is depicting a causal relationship. So we can read directly from the x-axis to predict that the average life expectancy on this island is Y1 under the initial conditions, the average of Tom and Hank. Now we're going to do the thought experiment. We're going to tax Tom a little bit, reduce his income from X4 to X3, and give that amount to Hank so that his income is raised from X1 to X2. Now, in the post-tax and transfer state, the average life expectancy of this imaginary island is the average of X2 and X3, which, as you can see, is Y2. It's gone up. And it seems like magic, but it's because of the concavity of the relation between income and life expectancy. It makes more of a difference to transfer the amount of money to raising Hank's life expectancy than it does to reducing Tom's life expectancy. And that's the thought experiment. So all other things equal, the implication is that a more egalitarian society will have a higher level of health and well-being compared to a less egalitarian one. That if you imagine many people on either side of the average income, you can see that the more narrower the income distribution, the higher average life expectancy will tend to be. So that's just the purely mechanical effect of absolute income on health. And it also means that the distribution of income matters independent of the average level of income. If we take a whole lot of countries with the same average GDP, those countries that have a narrower distribution of income will tend to have better life expectancy just because of this pure mechanical effect of the concavity of income. Now, the question is, how large is that concavity effect? And the answer is we don't know, except through simulation. And in the journal Social Science and Medicine, Brodish and Hakes did a simulation based on US data. So they took a large cohort study, which is a current population surveys based on the US Census that's matched to the National Death Index. And it's called the National Longitudinal Mortality Study of almost 250,000 American adults in midlife from age 25 to 59 years. And this is pure simulation doing exactly what I just did, which is if you transfer income from that end to this end, then how much of a life expectancy gain could we expect? And the answer is that in this simulation, each 10% reduction in income inequality measured by the Gini coefficient is equivalent to about a 4% reduction in total mortality. That's the one estimate of the concavity effect in America. Now, 4% reduction in total mortality doesn't sound like very much if you're not used to dealing in population health metrics, but it is a lot. It's a big deal because it's equivalent to eliminating all unintentional injury deaths in the USA. If you could prevent all car crashes, poisonings, homicide, then it would reduce total mortality by about 4%. Now, we know that that's an overestimate, or it's an upper bound estimate because it's assuming full causality, meaning that if you transfer income from here to there, that you will capture all of the difference in mortality, which we know is an overestimate because we're not taking account of reverse causation and confounding. And the other reason it's a upper bound is because it assumes no leaky bucket, meaning when we transfer income from Tom to Hank, that the entire value of that transfer reaches Hank, which we know isn't true in most social welfare type arrangements. If you take money, it costs money to extract taxes and to distribute it. So it's an upper bound estimate, but that's the one reason why I think income inequality matters. And you don't need to believe anything else I'm going to say from now on. All you need to do is to agree with me that income is partly related to health and that the association is concave. If you agree with those two statements, you have already agreed with me that income distribution must matter to average levels of population health. Now we get into the interesting stuff about other mechanisms why income inequality matters. And one is through what we call relative income deprivation. This pathway has been laid out in great detail by my colleagues, Richard Wilkinson and Kate Pickett, in their book, The Spirit Level. They argue that income inequality is harmful and its toxic effects are driven by what they call relative income deprivation. It's not just what your income is, but what it is in relation to other people's incomes. And the idea is that as the income gap widens, it engenders unfavorable social comparisons to people for people who are left behind. Your income can stay the same, but if everybody else's incomes are rising, you can feel left behind. And that social comparison can produce psychosocial reactions ranging from anger, frustration, hopelessness, despair that they argue are reflected by higher rates of violence, bullying, drug and alcohol misuse, and mental health problems. That's the whole argument of the book. Now, the way in which social epidemiologists try to empirically test this idea of relative deprivation is, I'm going to give a simple example. The paper I wrote with a colleague in Taiwan, it's not a perfect study because it's cross-sectional, but it'll illustrate how we go about trying to measure relative deprivation. So the sample in the study was a nationwide survey in Taiwan, a representative sample from 22 cities of working-age adults. And I'm going to explain to you the two empirical measures of relative deprivation that we used in the study, called the Yasaki Index and the CRI Index. And our endpoints are happiness, life satisfaction, subjective well-being, and self-rated health. Now, in order to construct a measure of relative deprivation, we need to make some assumptions. The assumption is that people tend to compare themselves to others who share similar characteristics. It's the idea of reference groups. So when income inequality widens and you feel left behind in terms of your living standard, presumably you are comparing yourself to some reference group. And the idea is that people construct these reference groups based on characteristics such as other people who belong to the same generation, of the same race, ethnicity, same educational attainment, same occupation, working in the same workplace, or living in the same area. Okay, so we can keep on going, but these are the kinds of characteristics that people use to construct reference groups. Now, the idea of a Yasaki index is quite simple. It is it's derived from this idea that for any individual I with income yi, who is part of a reference group with n number of people, the degree of relative deprivation for that individual is sum. See if I get, is there a pointer on this? Is the sum of the distance between your income and the incomes of everybody else in your reference group who make more money than you do. And so this index is, this I is 0 if you have greater income than your comparators, comparans, but it is 1 if you make less income than people in your same reference group, meaning people of the same age group, same race, ethnicity, living in the same area, etc. And so it's a very simple sum of the distance between your income and everybody else who make more money than you do. Now, the extension of the Yasaki index is an index called CRI, developed by the economist Hunk Patan. And this basically adds to the Yasaki index. This formula here is the same as the formula here. It adds this parameter alpha, which does this. When alpha is set to 1, the Yasaki index collapses to the CRI index collapses to the Yasaki index, the same thing. But when alpha is set below 0, then we're basically weighting the income comparisons so that more weight is given to incomes that are closer to yours within your reference group. Stated differently, it's an assumption that there is diminishing marginal sensitivity to incomes in your reference group which are farther away. And I think this psychological insight is borrowed from Tversky and Kahneman's prospect theory, which says that people tend to be more sensitive to comparisons that are closer to your own. By contrast, when we set the alpha value to between 0 and 1, we assume the opposite, which is that there is increasing marginal sensitivity to incomes further away, that within a reference group, you're more bothered by people who are making much more money than you are compared to those people who are making money closer to what you do. So to cut to the chase, this is just the illustration of how we go about doing this. So for health, happiness, and subjective well-being, these are the standardized betas, assuming different reference groups based on sex and age, sex and education, age and education, age, sex and education, and so forth. And we see that no matter what reference group we assume, every one of the beta coefficients is significantly negative, meaning that the more deprivation that someone has, the lower is their level of health, happiness, and subjective well-being. That's what all these negative numbers mean. And moreover, the Yosaki index and the CR index have about the same level of correlation with these outcomes. Maybe Yosaki has somewhat higher level of correlation than the CRI. So if we summarize what we reported in this paper, for each standard deviation in the Yosaki index, the 6 human flourishing outcomes decreased by between 0.1 to 0.2 standard deviations. So that's a moderate to important association. Remember, this is cross-sectional, so you have to keep that take it with a grain of salt. Although there have been prospective studies of the same indices done by others that show similar results. And these results are consistent across different definitions of the reference group, and based on some model fit criteria, the Yosaki index generally showed better model fits for the outcomes of interest. And interestingly, comparing the relative performance of the CRI index, we find that positive parameters generally showed better model fits, suggesting that individuals are more sensitive to comparisons to people whose incomes were more distant from their own income level rather than closer. I don't know quite what to make of it, but it seems that when people make comparisons, they're really bothered by incomes that are way, much higher than theirs within their reference group. All right, so that's, the kind of approach we take to try to operationalize social relative deprivation. Now, there's a critique of social comparisons, which is that they're often portrayed in terms of seeking status, that people worried about social comparison because they want to keep up with the Joneses. It's a kind of invidious social comparison idea driven by envy, but I'm going to argue that the effects may be not just about envy. Social comparisons often reflect people's accurate judgments of the need to keep up with rising standards of living. For example, owning a smartphone began when they initially appeared as a luxury, but these days it's a necessity, as the COVID-19 pandemic illustrated. And so relative deprivation in this sense creates what Amartya Sen refers to as a capability failure. That is the failure to participate fully in society. And so these things are not just about keeping up with the Joneses in the sense of invidious comparison. They are often about trying to participate in the society in which people live. Now, the other thing about social comparison is that although I've talked about people who are at the bottom of the distribution, there's increasing studies on the effects on wealthy people as well. The studies of comparison focus heavily on the behavior of those left behind, namely the despair of working class Americans who are turning to opioids and alcohol to assuage their pain. That's the kind of the Anne Case, Angus Deaton argument regarding deaths of despair in America. But I would argue that upward comparisons engendered by inequality also affect the behavior of rich people in ways that are detrimental to society. So when we think about the effects of comparison on wealthy people, we have to look to Thorsten Veblen, the theory of the leisure class, chapter 2, in which he talked about pecuniary emulation, that upward social comparisons drive conspicuous consumption by the wealthy. And the more wasteful and pointless the consumption, the more status that you gain among your peers. That's what he called positional competition. And we see this in reality, with a kind of veritable arms race of extremely wealthy people building ever bigger yachts. And that this is not just a trivial thing. The huge yachts that the ultra wealthy have been building have a substantial footprint on climate change because they discharge as much carbon dioxide as entire nations. Now, the extreme growth in incomes among the top 1% locks them into positional competition with each other, which is socially wasteful and damaging to the environment. That's a spillover effect of upward social comparison. So to summarize, so far we've talked about the toxic effects of upward comparisons. For the poor and middle class, this leads to pecuniary emulation, overspending, and getting into debt. Whereas for the top 1%, it drives conspicuous consumption and conspicuous waste. But don't forget, social comparisons cut both ways. We tend to look up as well as down. And there's increasing evidence of downward social comparison. What happens if you're at the top of the heap and you have lots of people that you can look down on? So in theory, downward social comparisons, that is comparisons to people who are less fortunate than you are, is supposed to cause people to become more empathic and charitable, right? But the opposite is often found among the rich. In fact, it tends to make them more entitled, selfish, and scornful of other people. That's the paradoxical finding of the psychology of downward social comparison. And I refer you to the work of Paul Pitt, a social psychologist in Berkeley, who's done a series of studies of how when you experimentally induce people to be the top of a hierarchy and then observe their behavior in the laboratory, he finds that they're worse at identifying emotions that other people feel. He calls it empathy gap. They tend to be more disengaged during social interactions, like checking their phones instead of paying attention. They tend to be more selfish than lower class individuals in dictator games. These are, games of strategic interaction. They're more likely to cheat to increase their chances of winning a prize in a laboratory game, and more likely to break the law while driving relative to lower class individuals. And these tendencies, you would argue, are magnified as the income gap between the rich and poor widens. I don't have time to go show all of the studies that he's done, but I'll show you this driving result. There's a kind of interesting study published in Proceedings of the National Academy of Sciences, in which he sent laboratory assistants out into the streets of Berkeley to stand on the crossings, traffic crossing. And state law in California says that if you see a pedestrian standing, you're supposed to stop, not drive past, as a BMW SUV is doing. So every time a car either stopped or just ignored the pedestrian, they would have a clipboard and count the number of times that happened. And basically, they classified the vehicles into low status versus high status, sort of BMW and Mercedes drivers. And the more expensive the vehicle driven, the higher the probability that they cut off the pedestrian at a crossing. So that's just one of the many pieces of evidence that Paul Pitt provides. All right, so that's the theory of relative deprivation. And I want to finish by giving an account based on political economy. The facts about income distribution in the US, especially, is that the share of incomes in the country during the past 4 decades is characterized by what Case and Deaton have called the Sheriff of Nottingham style of redistribution of incomes from the bottom 50% to the top 1%. So rather than you all know the Sheriff of Nottingham, right? This is the opposite of Robin Hood. So this is a reverse Robin Hood distribution has been taking place. That over the time frame from 1980 through to 2015, whilst the share of incomes accruing to the bottom half of American society has steadily declined, that's been kind of flowing upward to the top 1%. There's a case to be made that there's a redistribution going on, and I'll explain to you exactly how. One mechanism is through the political economy. This is some studies and data put together by the Columbia University political scientist Alexander Hertel Fernandez, called state capture, which describes the process whereby the top 1% spend more on influencing politics than the bottom 99%. That seems, completely obvious statement, but they do so in rather interesting ways. Whilst wealthy Democrat and Republican donors spend about equal amounts in terms of political giving, they concentrate on different goals. So Dems tend to focus on national politics, like getting their man or woman into the White House, winning the House and seat, for example. But Republicans during the last 3 decades have spent a whole lot more attention on state level as opposed to federal level politics. And the way that they have been doing this is through a little-known organization called ALEC, which stands for the American Legislative Exchange Council. Rather, I don't expect any of you to have heard of ALEC, but interestingly, when I poll my graduate students, no one's heard of it either. They've heard of UAW, and they've heard of NRA, but when I say who's heard of ALEC, there's not a hand that goes up. So these people are, operate under the radar, if you will. Well, ALEC is a coalition of about 2,000, mainly Republican state legislators, 300 corporations, which include tobacco, pharma, health insurance, oil and gas, private prison industry, and fast food industries, plus conservative donors and activists, such as the Koch brothers, the Scaife family, and Coors family. These are the sort of top, 1% of political donors in the country. And what they do, their mission is to disseminate what they call model legislation across states. When they have a kind of a mission to pass a certain kind of legislation in a state, well, they draft up the legislation and hand it literally to Republican state congressmen and senators. And as a result of this kind of activity, about 100 to 200 bills ended up being enacted each year across the states. And the focus of that legislation is doing things like overturning climate change laws, restricting reproductive rights, anti-LGBT laws, overturning Obamacare, loosening gun control, promoting private charter schools, et cetera, et cetera. So they're doing a whole lot of damage to a progressive cause, if you will. But the two things I want to focus on are the priority areas for ALEC's efforts with direct relevance to income inequality. One is state preemption of minimum wage laws. And the second is breaking the power of unions. So they've been very busy doing this at the state level, and Herschel Fernandez has been following this over a period of decades. So we start with minimum wage laws, where some of you may know a few years ago, there was a nationwide labor union movement called the Fight for 15, which was the fight to raise the federal minimum wage from the current $7.25 an hour to $15 per hour. And they had some success at the local and state level, especially at the city level, where urban centers in the country tend to be predominantly Democrat, even in deep red states. I'm looking at you, Columbus, So they had some success doing this. And so people, funded by the funders of ALEC, and ALEC, the congressmen, the legislators who belonged to ALEC became quite alarmed. And their solution was to pass a series of state preemption laws, which basically preempt, meaning they disallow cities from making their own legislation. If, Columbus wants to raise their minimum wage to $15, the state preemption law says, no, you cannot, because what stands at the state level must apply to every city in the jurisdiction. And they took a leaf from Big Tobacco, where Big Tobacco did this throughout the 1980s. Throughout America, in the absence of federal legislation to ban indoor smoking, they passed legislation city by city. If you look at Massachusetts, a whole bunch of cities like Brookline and Houston passed their own indoor smoking bans. And what the tobacco industry would do is to convince legislators to pass a state preemption law, which would override the legislation that individual cities passed. So this is a Hertel Cortez Fernandez mapping of the spread of local labor law preemption from 2000 to 2016. So as in 2011, when ALEC began distributing local labor policy preemption bills, such as preempting local minimum wage laws, you can see that the number of states that took this up, shot up, and they had enormous success in persuading state legislatures to preempt local legislation. And so these states in the orange are the ones where ALEC have had success in preempting local minimum wage legislation. There are lots of case stories about how, for example, Wisconsin passed an increase in minimum wage, and then later the state preemption meant that they had to reverse the increase in Milwaukee, minimum wage laws. And interestingly, this map, if you just look at the states which have successfully passed state preemption laws, they pretty much correspond to the same states where federal minimum wage remains at $7.25. So they've been doing quite successfully in terms of keeping down minimum wage hikes in those areas. Now, of course, because of the post-COVID economy, even in most states now, the lowest wage is, double the federal minimum wage because the economy is very tight. And the question is, what happens when the tight economy goes away? Then they will be back to $7.25. Now, the other priority area for ALEC's effort is breaking the power of unions. So there's a mirror-shaped relation between union membership and income inequality. This red is the proportion of union membership in America. In 1935, when Franklin Delano Roosevelt passed the Wagner Act as part of the New Deal, which allowed workers to unionize and to bargain collectively, union membership shot up and in step fashion, the share of incomes going to the top 10% declined. But because of the progressive war on union membership, especially since the 1981, you can see that there's been a mirror image relationship to the share of incomes going to the top 10%. Now, the way in which ALEC has dealt with this is by encouraging states to adopt what are known in America as the right to work laws, which is not to be confused with the right to work as a human right codified in international laws. This always confuses people who are not from the United States. You think right to work sounds like a wonderful thing we should encourage. But in the United States, the right to work refers to an employee's right to refrain from paying union dues or being a member of a labor union. So it has the exact opposite effect in terms of discouraging union membership. And between 2011 and 17, the introduction of state right-to-work legislation in 3 industries with the highest unionization rates at baseline, namely construction, education, and public administration, reduced union membership by 13%. And wages followed. Wages dropped in those industries by 4%. And these are the ways, there's sort of, concrete ways in which these laws, state preemption laws, is encouraging the rise of income inequality. And the map of statewide right to work legislation looks very much like the map of the state preemption for minimum wage legislation. There's, they have the same kind of states with high income inequality and areas where ALEC has been most active. Why does all this matter? Because ALEC is not formally listed as a lobbying organization. Namely, while corporations are required by law to disclose lobbying efforts or direct campaign contributions they make to political candidates, they are not required to disclose their funding for ALEC because it's not a lobbying organization. And the same goes to donors and activists associated with ALEC who are not required to publicly disclose their support. And thus, under federalism, a whole lot of laws are made at the state level on issues including taxes, labor union rights, labor market protections, healthcare, and so forth. And much of this is currently flying under the radar of national attention. That's the blind spot in electoral politics in this country, in the United States currently. So lastly, I want to talk about private equity firms, which is the other dimension of political economy. Some of you may have read the New York Economics Times, New York Times economics reporter Gretchen Morgenstern's book, These Are the Plunderers, which talks about the rise of private equity firms and how they are wrecking America. So the concentration of wealth in US and other parts of the world has been accompanied by a rise of private equity firms, companies that, again, most people would not have heard about. Everyone's heard about the investment banks like Goldman Sachs and Morgan Stanley and whatever, but few people have heard of Carlyle Group, Blackstone, KKR, Warburg Pincus, Bain Capital. And yet, these companies represent trillions of dollars of capital, which rove around the world in search of quick profits. And so they became famous initially because they basically went and ransacked the retail sector, causing companies like Toys R Us and FAO Schwartzman to collapse by taking them over and saddling them with debt. But more recently, that sector has become kind of saturated, so they have been making inroads into health, nursing homes, and in housing. In the United States, about 40% of emergency rooms in the country are now owned and operated by private equity firms. People don't know that, but that's the case, 40%. And as soon as they come in, the things that they do include replacing doctors with physician extenders, meaning people who are less qualified but cheaper. Buying nursing homes and reducing staffing ratios. There's been an MBER paper on how private equity firm operated nursing homes were partly responsible for the massive number of deaths during COVID-19 because of the low staffing ratios that they maintain. And they've been going into distressed housing markets and snapping up housing and driving up rents. And so as workers are laid off or rents driven up for the sake of maximizing profit, these private equity firms are actively causing that Sheriff of Nottingham-style redistribution from incomes from the bottom to the top. That's why the sense in which I said there's a causal relationship between the incomes of the bottom half going down at the same time as the incomes of the top 1% going up. All right, so I finished with critiques because I've had 40 minutes of raving about income inequality and health. And there are critiques, lots of critiques of people who disagree that income inequality matters for health. And these three critiques can be characterized as, number one, the effect of income inequality on health is modest. Secondly, that causality has not been established. And thirdly, that income inequality per se is not the problem, it's other things. So let's begin with the claim that income inequality and health is a modest association. Just a couple of months ago in the Middlebank Quarterly, there was a massive meta-analysis and systematic review published by a group in Glasgow, which gathered all the multi-level studies of area-level income inequality on health. And what I'm about to tell you does not refer to the relative deprivation, because that was not part of their scope of systematic inquiry. This is really about income inequality at an area level in relation to health. So they gathered almost 2.9 million participants in 38 cross-sectional studies and 10 million participants in 14 cohort studies of mortality. What do they find? So the first thing they found was that there is an effect of income inequality on self-rated health and mortality, but the effects are modest. So for every 0.05 unit increase in the Gini coefficient, which corresponds to the natural increase in Gini that occurred in the US between 1979 and 1990, they find that the odds ratios and relative risks of poor health and mortality were 1.06 and 1.02 respectively. So if you're an epidemiologist, these are what we call weak associations, because every 0.05 unit increase in Gini raises poor health and mortality by between 2 to 6%, which, if we think about how income poverty is related to mortality, the excess risk is 100%, but this is in the order of 2 to 6%, which led them to conclude that the effect sizes are modest. And it sounds superficially like something we shouldn't be worried about, but I want to push back on that, because in public health, we should be concerned with an excess risk of 2 to 6%. But for example, in air pollution studies, we know that each 10 microgram increase in PM 2.5 pollution is associated with between a 4 to 8% increase in the risk of all-cause mortality. So my argument is that we're in the same ballpark as air pollution studies. And in the US, that is sufficient for the Clean Air Act to try to regulate the population exposure to air pollution. So I think it's modest in the sense of being a small excess risk, but we're in the same ballpark as other public health problems that we would be concerned about. Secondly, the critique has been made that causality has not been established despite all of these cross-sectional and longitudinal studies. And the main reason is because residual confounding of area-level income inequality is possible because of unobserved variables. Many things run with change in income inequality, and the conclusion of this meta-analysis is that the evidence base remains uncertain because of the lack of experimental and quasi-experimental evidence. I agree. It's very difficult to find a quasi-experiment of change in income inequality. The reason why is because there are long lag periods involved between a change in income inequality and mortality at the population level. In some ways, I think you get a better idea of what income inequality does is by looking, decades apart between an increase in income inequality and population health effects. This kind of argument has been made by Hui Zheng, who wrote in a paper in 2022 that income inequality experienced during childhood is best at explaining variations in adult health. So that tells you that there are quite long lag periods between all of the things that happen when income inequality widens and the effect is observable in population health. And the reason why we haven't done looked at natural experiments is because they're very few and far between. All right, lastly, the argument is that income inequality per se is not the problem. This is an argument advanced by Case and Deaton, where they argue that income inequality is just the byproduct of what they call the rigged rules by which capitalism is played out. And so the objective of policy should be to punish the rule breakers, namely the corporate rent seekers and private equity firms engaging in predatory practices, not the redistribution of income per se. And I find that argument has enormous merit, but I would also point out that rigging the rules of capitalism, for example, through the kind of political capture I discussed through ALEC, would not be possible in the first place without the extreme concentration of economic power. Thus, I find myself agreeing with part of the point, but I think it would be very difficult to reverse what has been happening by simply going after the rule breakers. Rules are broken because having enormous concentration of wealth makes it easier to do so. So that's my quick summary of where I think the literature on income distribution is. Thank you very much.